Hidden deep inside your liver, there's this incredibly complex branching network of tubes. It's basically a plumbing system, and it's absolutely essential for digestion and getting rid of toxins. We call it the biliary tree. And most of the time, you don't even know it's there. But when things go wrong, well, the signs can be pretty dramatic. I mean, seriously, think about that for a second. It sounds like something from a sci-fi movie, right? A tree shriveling up and dying, but inside one of your most important organs. But believe it or not, it's not a myth at all. That withered tree is a very real medical sign. It's what doctors can actually see on imaging, a pretty stark picture that tells them the liver's hidden plumbing is in some serious trouble. So in the next few minutes, we're going to take a guided tour of this whole system. We'll look at what happens when things get in that shouldn't be there, what happens when the pipes themselves get inflamed, and even what happens when the original blueprints are flawed right from the start. All right, first up, unwanted guests. Sometimes stuff that has absolutely no business being in the biliary tree manages to find its way inside. Starting with, of all things, air. What's so cool here is how doctors can figure out what's wrong just by seeing where the gas is. It's all about the direction of flow, kind of like traffic. So bile flows out of the liver toward the center. Air that gets in that way is called pneumobilia, and it shows up centrally. But the portal vein carries blood into the liver, out toward the edges. If air gets in there, you see portal venous gas on the periphery. And that second one, that's a much bigger red flag because it could mean there's serious trouble somewhere else, like in the intestines. Okay, so air is one problem, but a bacterial infection, that's way more common. We call it cholangitis. It typically happens when the bile just stops flowing like it should, maybe because a stone is blocking the way. All that stagnant bile just sits there and becomes a perfect breeding ground for bacteria. And this leads to a classic set of symptoms doctors are always on the lookout for. It's a textbook trio. You get a fever from the infection itself, jaundice, that yellowing of the skin because the bile pigments are backing up into your blood, and this sharp pain right where your liver is. So we've seen what happens when invaders get in from the outside. But what if the problem isn't what's getting in, but an issue with the pipes themselves? What if they start to get inflamed, scarred, and clogged up all on their own? Well, that brings us to a really big one, primary sclerosing cholangitis, or PSC. This is a chronic disease where the bile ducts just get progressively more inflamed and scarred up. And the key thing to remember about PSC is its really strong connection to inflammatory bowel disease. And if you ever hear doctors talking about this, you will definitely hear this phrase. On an image, the ducts have these tight, scarred areas right next to little sections that are ballooned out. The whole thing ends up looking like a string of beads. Now, it's really important not to get PSC mixed up with its cousin, primary biliary cirrhosis, or PBC. This one's totally different. It's an autoimmune disease, which means the body's own immune system is mistakenly attacking the bile ducts, and it has a distinct profile. It goes after the smaller ducts, and you see it most often in middle-aged women. This chart really lays it out nicely. For PSC, think big ducts and a connection to IBD. For PBC, you're thinking small ducts, a very specific antibody in the blood called AMA, and the classic patient is a middle-aged woman. So two very different diseases that both, in the end, clog up the plumbing. And there's one more I want to mention, one that's especially common in Southeast Asia. It's called recurrent pyogenic cholangitis. And it's exactly what it sounds like. Repeated, nasty infections that end up filling the ducts with stones and sludge. For some reason, it often hits the left side of the liver harder. Okay, we've talked about invaders and we've talked about inflammation, but what if the system was just, well, built wrong from the very beginning? This is exactly where choledochal cysts come in. They're basically birth defects, abnormal swellings or bulges in the bile ducts, and because they're shaped weirdly, bile just doesn't drain properly, which can set someone up for a lifetime of problems like stones and infections. And a very specific inherited version of this is called Caroli's disease. In this case, the problem is all over the place, with tons of these balloon-like bulges in the ducts that are actually inside the liver itself. And Caroli's has this beautiful, classic visual marker. On an image, what you see is a dilated, fluid-filled bile duct making a circle, and right smack in the middle is a little dot. That dot is the portal vein, completely surrounded. It's a dead giveaway for this particular blueprint error. Okay, We've gone through a lot of different problems here: infections, inflammation, blockages, even birth defects. But here's the thing: a lot of these different paths, unfortunately, can lead to the same ultimate danger. See, all of that constant irritation, that cycle of damage and repair happening over and over again in the delicate lining of those ducts, it creates the perfect storm for something much worse. And that danger is cholangiocarcinoma. It's a cancer of the bile ducts. So, if there's one thing to take away from all this, it's this. It doesn't really matter what the original cause is, if it's PSC, or those repeated infections, or a congenital defect. Any condition that causes chronic inflammation in the biliary tree dramatically increases the risk of developing this very serious cancer. You know, the biliary tree is a perfect example of one of those incredible, complex systems that we never, ever think about until it breaks. It really makes you wonder, doesn't it? What other silent, absolutely essential networks are humming along inside us right now, completely